If you remember back to March of 2020, there was news out there about this virus, but nobody really knew much about it. We had a lot of people with this mysterious double pneumonia. We were calling it a double pneumonia or bilateral pneumonia and treating it like it was a bacterial pneumonia, but really those people probably had COVID and we just didn't know what it was yet. March, we knew what it was, and then throughout the summer, the ICUs started filling up, and they really did fill up.
I think of all of us, we kind of sit back and think, what were our lives like prior to COVID? What did we do all day long? But somehow it's basically consumed all of us.
I remember distinctly the first real patient that we had. And as soon as we got that patient, another one came.
This is that hurricane that has stalled out. We are in disaster preparedness every single day.
We couldn't practice medicine the way we normally practice it because we had such a volume of COVID patients. For the first time in my life, I thought about the finite healthcare infrastructure that we have in this country.
We as leaders really needed to make sure that our staff were as comfortable and as prepared as possible, and you had to take care of a patient who was scared to death.
I've been practicing emergency medicine for 23 years, and I have never seen people dying so quickly. And almost every single day we had them.
Never in a million years could I have imagined. I assimilate it to a war. It's just every day you feel like it's a battle.
Many, many patients did die alone with a nurse, there holding their hand, but not with their family there.
When this first started, you'd hear stories about someone passing away. Sadly, over the time, what's happened is everybody knows somebody who's passed away from COVID. It is a very serious illness, and certainly, unfortunately, has affected so many people.
We have more sad stories than happy. We lost a lot of people. Young, mothers, fathers. Unfortunately, there was nothing we can do about that.
At a caregiver level, at the front lines, my heart goes out to those folks each and every day. They're seeing people die that they've cared for days, for weeks, for months, frankly.
We found out 4 or 5 days ago that she didn't make it. You become part of the family, and it's heartbreaking.
It was 2 a.m. I was at the patient's bedside, and these were the words that will stay with me forever. I can't breathe. My chest hurts. I don't want to die. Please help me. I was so happy to see that patient walk home after an extended ICU stay.
Things are improving with COVID. We've gone through so many different surges. You wonder, when is this going to end? But since the vaccination came out and so many people are getting vaccinated, we are seeing a big decrease.
We have two things that we didn't have a year ago. We have treatment that works, and we have vaccinations.
We went from having 3 intensive care units and maybe 5 floors that were all dedicated to COVID to 1 floor and 2 ICUs. And I think by the end of the week, we'll end up with 1 floor and 1 ICU.
All the people that have shown up at our doorsteps to come to work each and every day for the past 19 months, no matter what they do, they've been here for their community.
Life outside the building is normal. They have no idea what is going on in here.
Time has marched on, and meanwhile, people in the hospital are still doing, they're still giving.
It's been an amazing journey, and it's been tough. I'm still getting up every day, just like you're still getting up every day. There's a calling that we have from the guy that's sweeping up to the floor to the CEO.
To just remember back to what that feeling was, that passion that you had, it's there.
Hang tight. Hang tough. We'll be stronger, smarter, braver on the other end.